I want to bring in Dr. Cedrek McFadden now. Dr. McFadden is a specialist in colon and rectal surgery at Prisma Health in Greenville, South Carolina. He's also the doctor you just saw in that story there. You know what, Dr. McFadden, let's just start with folks who are watching or listening on Sirius Satellite Radio right now. What should they be concerned about in terms of symptoms? Folks who think, okay, this might be something serious. What information do we have for them?
Well, the challenging thing about symptoms is that they're not mutually exclusive to colorectal cancer, so they can be present in a number of other health problems. What are the symptoms? Well, anal rectal bleeding, abdominal pain, unexplained weight loss, or even changes in the stool, either in the change in the size, the frequency of which you're going, or the consistency of the stool. And those are the ones that sometimes go ignored or disregarded.
The Colorectal Cancer Alliance found that since the start of the pandemic, screenings have dropped about 90%. So the Alliance is now launching this Pledge to Get Screened campaign. You perform my brother's colonoscopy there. Are you starting to see more patients like Ryan come in for an exam, younger patients?
Well, we're certainly seeing it, especially because of some of the more notable cases of colorectal cancer. Black Panther star Chadwick Boseman, that was quite influential in many young people, especially young African-American men, who said, that guy had it, I may be having some problems, let me go take a look. And, that's been the case for several of my own patients. And because of that, we've been able to identify and remove precancerous lesions that, if left there to grow, could have or would have become colorectal cancer.
We know that this is another kind of cancer in which black and brown people are disproportionately affected. But we don't seem to know exactly why. I mean, any ideas at this point why black people specifically are more at risk than others?
Well, in some ways, it's easy to look at the risk factors of colorectal cancer, one of those being obesity, where rates or the prevalence is higher in African-American communities. There are also others, such as genetic factors. But then there's a whole nother group of reasons, such as access to care, and not just access to care, but access to quality care, where there's an open dialogue between the patient and the doctor so that the exchange of concerns can take place, and so that patients can be heard, feel as if they've been heard, and have the action needed to take care of any health problems they may have. And in some cases, that can be a barrier, whether it be because of systemic racism or unconscious biases. Those things can be a barrier to receiving the health care that people, especially in the African-American community, really need.
Dr. Cedrek McFadden, that's a good spot to end it on. Thank you, my friend. I appreciate all of your time. Thank you for helping save some lives today. Have a good weekend, buddy.